heading the cosmetic surgery department in PSG Super Specialty Hospitals, Pyramid, Coimbatore. Today I would like to convey a few things regarding hair transplantation. Hair loss has become a major issue and problem for all youth and elderly people. Nowadays we hear people as young as 18 years old losing their hair. There are many factors that contribute to this loss of hair, like change in lifestyle, stress, environmental factors, lack of proper hygiene and food, and also lack of nutrients. Then another important reason is using various chemicals that are available across the market, which are used indiscriminately, leading to early hair loss and premature graying. There are various treatment methods available today to treat hair loss. When you come in the initial phase, we try to analyze and find out what is the cause for your hair loss. We do a trichoscopy, we do the blood parameters to check whether you have any hormonal imbalances, and we determine whether it is because of any disease or it is because of a genetic condition. Male pattern baldness, which is supposed to be the commonest cause of alopecia or baldness, is the predominant type and it is genetical in nature. Though your father or your grandfather might not be suffering from male pattern baldness, still you can inherit it through your recessive genes. And once the male pattern baldness starts, you have to intervene at the earlier phase to prevent hair fall and also make the hair follicles grow. We should all remember that losing 100 hairs per day is a very normal phenomenon because hair growth and hair loss is a cyclical phase. But if the hair loss is more than what hair is growing on your head, then you are in for a serious problem. So initial treatment is with platelet rich plasma, that is PRP. PRP is used as an injector or we use it as a mesotherapy using a derma roller. Apart from PRP, we also prescribe drugs like minoxidil, which is very effective in stimulating the growth of the resting follicles, and also some people we prescribe drugs like finasteride, which is supposed to help in new hair growth. But if the person is not responding to this particular treatment, or in spite of the treatment the hair fall is continuing and it has come to a standstill, we suggest that they go for hair transplantation. There is a general fear that hair transplantation is a very major complex process and it has got lot of dangers. Be rest assured, hair transplantation is a very simple procedure. It is done aseptically in an operation theatre under local anesthesia only, and in trained and safe hands your condition is always very safe. And for hair transplantation we use a minimal amount of drugs to give you the numbness, as well as also very less medications are given both pre-op and post-operatively. And during hair transplantation there are two methods by which we commonly do it. One is called as the FUT method or follicular unit transplantation, which is also called as the Slit method, and the other method is called as the follicular unit extraction or FUE. As you all know that hair commonly in the temporal, frontal and the vertical regions only are lost, whereas the hair above the nape of the neck, that is in between the two ears, is usually not lost and is called the permanent root hairs. These hairs are resistant to the effects of dihydrotestosterone and they will usually survive even in patients who have severe baldness. So these hair follicles are first assessed and estimated, and from there the intact hair follicles are harvested and they are put in the recipient site. And for doing that, strip harvesting is a method where you need large number of follicles to put in the donor area, in the recipient area. So a large number of hair follicles can be easily harvested in a single sitting by the strip technique, and these hair follicles are separated using a microscope and they are implanted in the recipient site. FUE or follicular unit extraction is now the gold standard, where individual hair follicles are harvested using an FUE extractor and then they are planted in the recipient site. The most important things as far as hair transplantation is concerned is the state of the donor site, the number of hair follicles that are present over there, and the recipient site, whether it's a healthy skin or it's an unhealthy skin. All this is taken into account. Then we design the frontal hairline, which should be designed aesthetically. then only it will give a very natural hairline, and single hair follicles are planted in the first 2 rows, and inside we usually plant the 3 or 4 follicles, which will give a denser hair look. And the donor site, usually we only harvest about 1/4 to 1/6 of the grafts are taken, so that that area does not get scarred and it is covered by the remaining hair. And after the hair transplantation is done, it is very important that the patient follows all the instructions very carefully. That is, maintenance of the recipient site and donor site, cleaning it regularly, and using a mild shampoo after a couple of days. All this is very important. Only when the patient is able to follow all these procedures, the results are extremely good. Hair transplantation is now being done in various places, but here in PSG Hospitals, we have an exclusive operation theatre with 6 operating microscope and a very dedicated team of trained technicians and doctors who will be doing the procedure. So the results are usually very amazing and very safe also. If you have any queries, you can contact Dr. Radhakrishnan, Department of Aesthetic or Cosmetic Surgery, 5th floor, PSG Super Specialty Hospitals, Coimbatore. Thank you.